Head lice, a parasite. What are head lice? How do head lice spread? Who is at risk? What is the treatment for head lice? I'm Dr. Nadeem Sajjad Raja. Head lice, about the size of sesame seed, are small insects that live on people's heads. Head lice are parasite. They feed on human blood to survive. The eggs, called nits, are even smaller, about the size of a dandruff flake. Lice and nits are found on or near the scalp, most often at the neckline and behind the ears. There are 3 types of lice. 2 others are body and pubic lice. Each type is different from others. How do head lice spread? That is very important. Head lice move by crawling. They cannot fly. They spread from person to person. They can spread through sharing personal belongings such as hats, hairbrushes. Head lice do not spread any disease. Who is at risk for head lice? Children, usually between ages 3 to 11 years, and their families get head lice most often. This is because young children often have head-to-head contact while playing together in the school or at home. What are the symptoms of head lice? Tickling feeling in hair, itching in head, sores from scratching. Sores become infected with bacteria and then develops bacterial skin infection. Sleep disturbance as head lice active during night time. So treatment options for head lice. Treatments are available over the counter and by prescription. By prescription items, usually benzyl alcohol lotion, ivermectin lotion, malathion lotion, spinosad suspension are prescribed by the doctors. So these are approved drugs and require, as I mentioned, a prescription from the doctor. If you are not sure about the treatment, ask your pharmacist for over-the-counter drugs or doctor for the prescription. Always seek guidance before using any treatment, especially if you are pregnant, nursing, or using treatment on child. All household members should receive treatment altogether just to get rid of head lice in family. So how we can prevent getting head lice? Wash your clothes, bedding, and towels with hot water and dry them using the hot cycle of dryer. Soak your combs and brushes in hot water for 5 to 10 minutes. Vacuum the floor and furniture, particularly where you sat or lay. If there are items that you cannot wash, seal them in a plastic bag for 2 weeks. Then head lice or nits will die. To prevent your child from spreading lice, that is very important. Teach your children to avoid head-to-head contact during play and other activities. Teach your children not to share clothing or other items they put on their head, such as headphones, hair ties, and helmets. If your child has a lice, be sure to check the policies at school and or daycare. Your child may not be able to go back until the lice have become completely treated and your child is free from head lice. Thank you very much for watching this video.